Morning, Mr. Chair and Commissioners. I passed out our trend of numbers that we continue to follow, the number of cases in Clay County. You can see now the confirmed cases are 625. So, you know, it's a gradual climb, but you know, we expect that with some testing and things, so not alarming at all. The numbers that are out of isolation or of recovered are the 554, so we still have 33 active cases, which kind of goes up and down depending on the numbers tested. So 33 that we're following, and then the deaths have remained the same for the last few weeks, so we haven't had any increase in deaths in Clay County. In Minnesota, we have 42,700 positive cases. I don't think you have that on your sheet. 37,200 no longer need isolation. So those numbers are fairly steady as well. 4,000 of those numbers were healthcare workers. They had 1,504 deaths in Minnesota. 1,172 were from congregate care, long-term care facilities and others, which is low compared to most of the other states. And hospitalizations have been remaining low as well throughout Minnesota. And the hospitalizations and in Sanford locally continue to be stable. So they average maybe around 4 to 12 patients that are COVID related. So their numbers have remained low, which is good. And the numbers in ICU currently right now are only 4. So that's good as well. I don't have the numbers of Essentia, but those numbers have remained low also. So it's good that we're not on an upward trend like we see in some of the other parts of.
Kathy, when you say active cases, are those cases that are all in the hospital, or?
On
Like we got 33 active cases at Clay. Are they all in the hospital then?
No,
or?
those are ones that are positive that we are following. We're doing case investigation on those, and then contact tracing on the contacts, but that's 33 cases that are just currently right now we are following in Clay County.
Do we have an idea how many are in the hospital concerning this, or
We don't know how many of Clay County residents are in the hospital, but we don't, as far as I recall from our Red Cap, it's a system that the Minnesota Department of Health uses. I don't remember any that are hospitalized that we are following from Clay County. So these are all just at home recovering. We see our numbers of the young people are rising,
yes.
Not only in our county, but across the country, because I think just I think they're not following all of the guidelines, is most of what they're seeing across the nation, that they're really, you know, it's the COVID fatigue is what they call it, and they're tired of wearing masks, and they're tired of social distancing, so we see large numbers of those increasing. It's not so worrisome for youth to get COVID as much as it is people with chronic health conditions or the elderly. However, they're spreaders, so they tend to then spread to those that are more susceptible. So, you know, that's a concern, and we'll have that concern for a while as we have our college kids returning and schools in session. So we're going to see, we expect to see a bit more of that. And Cheryl will talk a little bit about the colleges and the plans. So.
Can I ask a question quick?
Sure.
I have our sheet that you handed out last week and then this week's, and I'm noticing that some of the numbers are tweaked a little bit in terms of active cases. Last week I thought there was 20 active cases, but now it says there was 39 active cases. Or is there a lag in how that information is reported?
Yes, there is a lag in when so we get the current ones, but there's a lag in the numbers that they are putting down across the state in Red Cap. So there is a bit of a lag. We're also seeing a little bit of lag between reporting across the river too. So we're noticing there's a little bit of a lag from the North Dakota reports to get to Minnesota. So those are the discrepancies in those numbers.
Okay, thank you.
So, yeah, go ahead, Cheryl, with the planning of,
Good morning. So as I mentioned last week, we were having some meetings with our higher ed entities, and that has continued. There was a representative from Minnesota Department of Health that came to Moorhead yesterday and met on 2 of the campuses, so we did a virtual meeting with them. And just to help guide them through the guidance, because sometimes some of that can be a bit confusing for schools, and to answer questions. Of course, one of the questions that came up was about contact tracing for our college students. And so as Kathy and I and Jamie explained to them that we are doing a case investigation and contact tracing at public health, but the higher ed entities could be a huge asset for us, because if their students are living on campus, they certainly have the information of what classes that student may be attending, if they're sharing a dorm room with another student, and what their activities are on campus to assist us with expediting that case investigation. Also wanted to mention that I've also reached out to our K-12 school districts in Clay County, and I am a school nurse for the Ulen-Hittedal district, and so I've had a few conversations with the superintendent up there and in our planning for fall and what that's going to look like for them, because there has been guidance that has come out between Minnesota Department of Education and Minnesota Department of Health. But as we have learned over the last 5 months, information with this virus changes frequently, and so there may be some revisions to that guidance, and we can serve as a huge resource for those school districts in helping them with their planning.
Are the colleges planning on doing anything as far as, I don't know, because I always thought that the first year as a freshman, you were supposed to stay in the dormitories if you're from out of town or whatever. Is that requirement still going to be, do you know, if that's been discussed at all?
Not necessarily. You know, they're working through some of the things on their own, but they, you know, are looking at, especially if a student becomes ill, if they live locally or within a region that isn't too far of a distance, that student may be able to return to their home address with their parents or wherever their permanent home is for that duration, to avoid you know, having to stay at the school in a room by themselves.
Okay.
so yeah, it's not confirmed yet, for sure. So they're planning that, but I suspect that will not be a requirement.
In terms of, I'd heard some issues on the news in regards to international students and online education and what the requirement is. Do you have any numbers in terms of what the percentage of international students the universities have?
I apologize, but I don't have that number.
We can get those numbers though, because we'll be meeting with the colleges on a regular basis, so
Yes.
we can get the number of international students that they have typically and what they're predicting for this
Because
fall.
my guess would be in terms of landlords, there's a large percentage of
Right.
students
And on both
that could affect it.
MSUM and Concordia campuses, some of those international students from last year were unable to return home at the end of the spring semester,
Right.
and so have stayed on campus during this time.
Thank you.
And just to add to that, the K-12, they do have 3 scenarios that MDE put out. So it's the in-person learning for all students. There's the hybrid learning, so with social distancing and capacity limits, and then also complete distance learning. So they have 3 scenarios, and they will base that dependent upon what is happening in our community at that time. So whether they determine that they need to not have any in-person or they can do partial in-person, they're working on all of those scenarios. And then Jamie will talk a little bit about masking, et cetera.
Good morning. I just want to highlight some of the things that we've talked about and what we've seen over the past week as a part of our meetings with both the state and the local level. Apologize for my voice. I think I've been talking to a voicemail and our computer things too much because everything is virtual, but So one of the things I just want to say is that we have a very strong team, as we've talked about, doing case investigations. And so I think that's a critical piece of why we have been so successful in our community in terms of controlling spread. Although our cases continue to rise, we've got just a little bit of, I think about 40 cases that we've seen from before the 4th of July till right now, and so we're getting very close to that 14-day window. And so I think that's pretty good. And so there's two things. Basically, because of the case investigations that we're doing locally, we're responding quickly, and we're actually when people are reaching out to public health and saying, okay, I got tested, we're asking them to get back to us as soon as they can when they get their test results. That allows us to respond a little bit quicker than when it goes through the Minnesota Department of Health and goes into what we call our queue of cases. And so we've been more timely in terms of responding, and I think that's an excellent reason why we have seen a good response. Another thing is that the guidance from Minnesota Department of Health has been very good. So our staff that are working doing the case investigations, what they're getting when they call and talk with people is they're getting, yep, my employer knows what to do. Yes, I was at a gathering for the 4th of July, but my employer is set. So I think the guidance, and even though we are still out and engaged in the community and businesses are opening, we are maintaining that social distancing, and that's a big part of why we're seeing success. They're ready now and they're prepared. So looking at our long-term care, we haven't had any additional deaths since that time frame as well. So they've got it down and they know what they're doing. They're starting to open up our long-term care for visitations, but they're very well thought out and planned. They're communicating well with families in terms of what the expectations are. But that being said, there is still research out there is starting to point to the fact that even though we are not symptomatic, we are spreading the disease. And then what was stated yesterday at one of our calls is that it's looking like we may even be peaking before we actually have symptoms in terms of our contagiousness. So can't stress enough how important the social distancing is. Unfortunately, masking has become very political, but there is research to show that the masking is helpful. There are some of there's some pressure or advisement for the governor in Minnesota that's coming from the Minnesota Medical Association, the Minnesota Nurses Association, to actually consider a requirement for masking in public settings. There is the city of Winona, Rochester, Mankato, and Edina that have enacted mask requirements. And then there's the city of Duluth and St. Cloud that are considering it. So I think, again, I know that's political, but just so that you're aware of that discussion is happening and that there is some advisement coming from the Medical Association and the Nurses Association in Minnesota. Social distancing, that is the best way that we can try to prevent that spread, and we need to continue to maintain that. It seemed like in the community, I don't know if you noticed that, but I noticed there was kind of a drop in mask use, and now there's an uptick in mask use again. But that general, I drive by the motor vehicle department every day coming to work, and they're clearly marked spots where they are supposed to keep their distance, and I think whatever we can do in order to make it easier for people to comply with that social distancing, I think that's an advantage. So basically that's, we've kind of shifted our focus from long-term care to working with schools, as Cheryl and Kathy talked about. There's excellent involvement in terms of making sure that we have options to make sure that our students return safely, and I think there's a lot of work being done behind the scenes. So that's pretty much, I probably said too much opinion stuff, sorry about that.
Well, when we do the social distancing, like we are here and stuff like that, you feel the masking should be utilized? And I mean, if you even look at our church sometimes, we don't have very many members there right now, but we're 15, 20 feet apart. We're all sitting there with masks on, and I don't know, is the mask doing any good there? Or?
I think that's basically what the science is looking at, is that we try to stay 6. You saw how I sat next to Kathy a little too close and then I scooted over again. That's basically, it's difficult. If it's not marked out for us, it's difficult. I understand what you're saying, for my rural community also, the churches are looking at, and we just have to constantly remind people it doesn't mean just 6 feet this way, but it means that 360 degree. But it's difficult to maintain, so that's why if you go into a store and you can't maintain that distance, the mask is helping to protect all of us around. It's an extra precaution because you never know where you're going to end up coughing, and then the more like I'm projecting my voice because I'm hoarse today, the more I project my voice, the more the particles come out. If I happen to be infectious and I don't know it, that's how the spread happens.
Thank you.
Mr. Chair.
So just to add, like Jamie mentioned, so in churches, when people are singing, the particles go further. So the science is showing that if you sing, you're hollering, you're projecting your voice, that particles will go farther than 6 feet. So that's part of that. The mask is the second layer of protection. So they are recommending that. And then the exposure time is being within 6 feet for 15 minutes or longer. So if you are within 6 feet for 5 minutes or even 10, that's not an exposure. But it's 15 minutes or longer is the time frame for someone to be exposed to the virus.
Okay. Kevin?
Thank you. Kathy or any one of you will want to take this one. I want to go back to the K-12 for a minute. And, there's all kinds of discussion now about schools and school openings and kids and transferring of the virus. You get to the point where you don't know who or what you should believe anymore. Has public health come out, whether it's through the CDC or whatever, with confirmation about this where kids aren't likely transfers of the disease, and by what age would it mean? Is it kindergarten to grade 4, or is it kindergarten to grade 6? Where's the cutoff on that? Where all of a sudden maybe they don't transfer, now they do, or less likely to transfer, I should probably say. I'm assuming any one of them could transfer, but so is there any information on that?
They don't have a specific age category at this point. They're still studying that. So at what age, when you are positive, will you be able to transfer or spread? However, we do have some daycares that have some positive kids. So we're really conscientious of that because if there's more than one kid, then they clearly have spread that to each other. So that's a concern. And then spreading it to adults. I know there's some teachers that have some concerns, who have some health issues,
Okay,
and
yeah.
the concern is to experience that
I guess
spread.
I'm just trying to
Yeah, there isn't an age category where they're saying no.
weed through and trying to get to
Yeah,
the direct science of it. That's, they
right.
might be able to have strong indications that maybe kids, through the 4th grade
Yeah.
are much less likely to transfer it even if they do carry it. I don't know, so I
No,
just
and
put that out
and
there
that's
as
still
a
being-
question for the public. And then if I can just switch a little bit, I read an article yesterday in the FM Extra about an individual who had contacted, came down with the virus, and now is donating plasma. And in the article it said that could actually help 5 other people who might be in intensive care in terms of the therapeutic piece of. So if that's the case, are we encouraging? Now I see here that we've had 625 confirmed cases in Clay County. When we know they're no longer carriers, do we encourage them to look at donating plasma? Is that part of our process, or could it be, or should it be?
It hasn't been, and the recommendations usually are from their healthcare providers. If they are going to recommend that they think about that, it's not part of the process for our contact tracers or our case investigators. So MDH is not stating that we should encourage or push that, it's optional, but we don't bring that up, but that's certainly
So we don't know if healthcare providers have that as a list of items that they should talk to their patient about.
Right, exactly, yeah, and my understanding is that's not a regular thing that they're discussing, so. But that certainly is a viable option for people that have been positive, if they check with their healthcare provider and encourage that, but not as a typical process.
I know that Vitalent, which is our local blood services, has definitely done some advertising and encouraging people who have recovered from COVID-19 to contact them to see if they could possibly be a candidate to donate plasma.
Yeah. I guess, from my standpoint, somebody who may have had COVID might have other conditions that would not allow them to donate. But I would certainly think that, when we're seeing, especially the elderly who get this, and if it's a therapeutic that can help them, we should be, I think we should be promoting any options out there that could assist in that regard. So I'll leave it at that.
Any questions?
Mr. Chair?
Yes.
If I could just briefly follow up on Jamie's comment on masks, just from a county perspective. Well, first of all, I think I'd like to just acknowledge the work of Kathy and her staff. We're going on nearly 5 months now, and for her incident command team, it doesn't end on Friday at 4:30. This is 7 days a week into the evenings, and we're just extremely fortunate to have Kathy and her staff do the work that they're doing and keeping us up to date and being able to make the decisions that we do based on that information. So I just wanted to acknowledge their great work. Secondly, I just want to comment, last week, the Supreme Court in Minnesota put out an administrative order that requires citizens and staff who are participating in any court type of business here in the county to wear masks. So anybody that's court administration, well, we're not having jury trials yet. If you're part of the jury, if you're coming to watch, you are required now to wear a mask, and we do have masks at the front. That's been provided by the state. And so just for our citizens, if they're coming to the front and they're not wearing their own, just to be aware that that's something that they'll be asked to put on while they're here when they're conducting any kind of court business.
Thank you. Anything additional?
And just a quick, for Commissioner Haney, they did cancel the press conference for tomorrow, so.
Okay.
And just came up late last night that they decided to cancel, so.
Well, thanks for letting me know.
All righty then. Thank you so much for keeping us updated, and thank you for your work in that.
Thank you.
Thank you.